Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is what you need to know about joint arthritis. Arthritis is the number one leading cause of disability in America. Over 50 million Americans are affected. Arthritis is inflammation of one or more of your joints, with the main symptoms being joint pain and stiffness, and typically worsens with age. There are two main types of arthritis and a lot of minor ones: osteoarthritis and rheumatoid arthritis. When I say minor, I don't mean that it's minor pain. I just mean minor in incidence. Okay, different kinds. Arthritis refers to wear and tear, degenerative joint disease, often shortened to DJD, and it causes cartilage to break down. Rheumatoid arthritis involves an autoimmune disease that actually targets the lining of the joints first and then leads to joint breakdown. Other types include psoriatic arthritis, lupus, crystalline, gout. Osteoarthritis becomes a ratio problem as to why it occurs. We continue to make cartilage like we always did throughout life, okay? But as we age, we start to break it down faster. So it becomes a ratio problem, and that's one of the main reasons why osteoarthritis occurs. With rheumatoid arthritis, it's women greater than men. It's not hereditary. It involves the immune system making antibodies against the tissues in one's own body, and that's the synovial lining of your joint, and then it shifts into joint degeneration. Well, what are the risk factors for arthritis? Family history, increasing age, females more than males for rheumatoid arthritis, males greater than females for gout arthritis, post-traumatic, which is a car accident, sports injury, and then obesity. More stress across the joint leads to higher incidence of arthritis. Symptoms may include pain, stiffness, swelling, decreased range of motion. Treatment options. There are quite a few treatment options for arthritis to help people obtain pain relief and avoid surgery. The simplest is activity avoidance. If it causes you pain and hurts, don't do it, okay? If you're running 4 or 5 days a week, switch to cross-training with swimming and cycling, those kinds of things. Over-the-counter medications may include anti-inflammatories and Tylenol. There's also topical prescription pain creams, which can work well. A brace, such as you see here for the knee, or a cane. A cane in and of itself can take 50% of the weight off of a person's joint. Okay. Physical therapy and chiropractic. Physical therapy can help strengthen up the muscles around an arthritic joint and therefore help lessen the pain in that joint. Acupuncture has been shown in dozens of studies to be really good for arthritis. And then TENS units have some small foam pads that go on the arthritic area, and they emit small electrical impulses through the skin, and that can help change the way the brain perceives pain signals. Interventional treatments for arthritis may include steroid injections. These have been a gold standard for decades. It used to be thought that steroid was deleterious to one's cartilage, but now that's not been proven. Okay. Hyaluronic acid. We have hyaluronic acid in our joints anyway. It's like the lubricant. It's like the motor oil. But injecting more has been shown in several studies to be beneficial. Prolotherapy. PRP therapy involves your own blood spun down to get the platelet-rich plasma in the middle that comes out of it and then injected. That can be very beneficial. Stem cell injections are becoming more commonplace now with either bone marrow or fat-derived stem cells, and the newest is amniotic-derived stem cells. Radiofrequency ablation is coming into place for more and more joints, especially the spine. Studies have shown up to 2 years of consistent pain relief with a radiofrequency ablation of the facet joints. Well, what are the outcomes with non-operative treatment? The vast majority of patients are able to avoid surgery for arthritis or delay it significantly. Joint replacements are simply not meant to last forever. It's a quality of life procedure. Success rates with the steroid, hyaluronic acid, and the regenerative medicine injections like PRP and stem cells are over 75%, and radiofrequency ablation is over 80%. Topical pain creams have been looked at in a study with over 3,000 patients and been shown to be 83% effective for all types of conditions, including arthritis. Thankfully, arthritis is not a deadly disease. No one ever died from it, so if all attempts should be made to treat it non-operatively. The top non-operative pain management in the Dallas-Fort Worth Metroplex area is through the Texas Pain Network. There are several clinics accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.